Welcome to the She Found Motherhood podcast. It's Dr. Alicia here, and I have an amazing guest who is going to be talking to us all about what we need to do to prepare for our maternity leave. Now, it probably seems pretty easy. You put in the paperwork and there you go, but there's really a lot more to it than that. So, the earlier you can start preparing and planning for the maternity leave, the smoother that transition will be. Sonia from Maturn, Canada, will be joining us to talk all about this transition and what her top tips are on how you can prepare to make it smoother. We'll get to it right after this quick reminder.
Welcome to the She Found Motherhood podcast. We are doctors Sarah and Alicia, maternity physicians and moms who have been through it all. We want to empower you with knowledge so you can have the best pregnancy, birth, and postpartum experience you can.
She Found Health and She Found Motherhood is meant for general medical information only. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. This information does not apply to every situation. If you have questions or if you've received different advice, please contact your healthcare provider. Always seek the advice of your physician or another qualified health provider with any questions you may have regarding a medical condition. The views expressed by She Found Health and She Found Motherhood and our guests are not representative of any of the institutions with which we are affiliated. Some of our podcast episodes are sponsored so that we can keep getting great info out there to you, our listeners. We only partner with companies that we truly believe in. Some of our links and suggestions may be affiliates, and we would appreciate you using them to help fund this important work. Now let's get to it. Welcome, Sonia. Thank you so much for joining us today. We are going to be talking about how to prepare for maternity leave on the podcast today. And you are a bit of an expert. You and a colleague, Jen, have also started a company in supporting pregnant people on their journey through their maternity leave and preparing for returning to work after maternity leave. So why don't we start by you just introducing yourself and maybe telling us a little bit about Maturn, which is the company that you've created with your colleague, Jen.
Yeah, thank you so much for having me. It's a pleasure being here. So, I'm Sonja Baikogli Foley, one of the co-founders of Maturn, and I am a mom of two. I have navigated two maternity leaves, and when I went on my first maternity leave, I was rocked to my core. Like, I just had no idea what it would be like. And truly, like I just wasn't prepared for the many transitions that you go through on maternity leave. And I've always been a very career driven woman. I spent my career in not for profit, private, and most recently I was in the public sector. I was leading the government relations for the city of Vancouver, where I was working with the federal and provincial government to advance city priorities. And having a baby was a really big deal because it was such a pause in my career. And it was something that I was really nervous about. And I wish I had the foresight and the preparation for what was to come so that I could better prepare myself for those transitions because it was such a whirlwind. Like you just take it as you go. And so Jen and I connected about over a year ago about the idea of providing more support for mothers when they transition to and from maternity leave. There are so many baby focused activities and programs when you're on maternity leave, but not a lot of programs to truly support the mother. And so we founded Maturn out of a desire to really support mothers while advancing equity. There's such an opportunity to support mothers when they go on maternity leave because it is a really pivotal time and it's a big pause in a person's career. And so we launched Maturn last year in the fall of 2021 and are working with women who the women in our program right now have recently transitioned to maternity leave. And yeah, it's a hybrid model, the Maturn program. So we support mothers from the moment they know they're expecting a baby all the way up until those first 2 months back at work and then everything in between. And so we have online modules. We have 8 online modules. The first module is all about the before the baby arrives, so transitioning to maternity leave. And then, we talk about the identity shift, self-care, what is equitable partnership planning? And then the last 3 modules, we talk about the return back to work because that is such a crucial transition. That's a little bit about me and Maturn.
Amazing. Incredible. And You've got some pretty incredible guest speakers on there. Sarah and I did, not that Sarah and I are incredible. We're pretty awesome,
Yourself
but we did.
included. Yes, yes.
We did one of the modules for you, but there's some pretty incredible people that
Yeah.
you've gotten involved in that. So it's an incredible venture that you guys have done and such a supportive thing for people because it's a hard time doing that and shifting back and
Yeah.
forth, and there's so much complexity to it, both from just a logistics point of view, but also from an emotional point of view and a physical point of view.
Yeah. The
So thank you.
normalization of it, right? Like we don't talk about all the things that happen because you're just expected to figure it out. And it's like, what if we actually talked about it, brought people together and shared those challenges and provided tools and resources on how to meet those challenges? There's a different way to do this. We don't have to do this the way we've done it just because we've been doing it this way for so long.
And so that's a little bit about what we're going to chat about today, is that creating that transition plan, looking at kind of companies' policies on leave, and starting to think about how to prepare yourself for that transition to maternity leave. So why don't we get started?
Yeah. So there are lots of factors to consider as you are planning for your baby's arrival. We actually dedicate a whole module to this because administratively, emotionally, logistically, there's just so many moving pieces that no one really tells you what to do and you're just supposed to figure it out. One of the first things that we talk about is getting organized, right? Create and share a maternity leave transition plan, which we actually offer for free on our website. So if you are interested, you can go and download that from our website just to get a sense of what that transition plan could look like. Really like asking yourself questions like, when do I want my last day to be before I go on maternity leave? Do I want to work right up until the last minute? What, if any time, do I want to take for myself before the baby arrives? And what would I use that time for? So really getting mindful about the time you have between now and your impending maternity leave. What are some of the projects that you feel are most important that you need to have continued oversight on between now and your leave? And what do I need to like relinquish control over and delegate to other people? I need to talk about childcare because that is a challenge for almost everyone, I would say. You're very lucky if that is an easy thing to establish, but we really encourage soon-to-be mothers to think about childcare planning before they go on maternity leave. And again, we have a whole list of things to consider when you're choosing childcare, because there are many types of childcare out there and not all of them are right for you. And so it's really important to understand the differences of childcare, the questions to ask when you're going on those tours, and understanding their philosophy around learning and how that fits in with your values as a family or if you're a single parent. So that piece we cannot highlight that piece enough because so many mothers returning back to work, one of the challenges is I don't have childcare, so they can't go back to work. So what if we can help set you up for success so that you don't have that challenge? Not to say it's going to go away by starting before, because still mothers are on 3-year wait lists and still can't get in. Really like getting organized, preparing, familiarize yourself with your maternity, parental, and adoption leave benefits at your organization. Understand your policies. Are you going to receive extended health benefits? And what does that look like for you? And understanding your vacation accrual while on maternity leave. And then thinking about the actual transition, creating a transition plan that you can then share with your employer as to how you want to go on leave, what project you're working on, so that there's a documentation of the processes and projects that you're involved in. And then a plan for how you are going to teach those who are going to be covering for you, or if you do have a replacement, to really train them on what is coming up. And also connect with parents that are at your work. So if you have an employee resource group, an ERG at your organization that supports parents, join that group. Or even find a person at your organization that has navigated maternity leave so that you can have an ally. And maybe one of the suggestions we make is keeping in touch with one person, or one or two, however many you want. And so maybe connecting with that parent and asking if they're willing to connect with you over the course of your leave, if that's the decision that you make, right? It's all about empowering the mother to make this leave about the kind of leave that they want. So if you don't want to stay connected to work, that's totally okay. But then there are some mothers that want to stay connected. They want to receive the monthly updates, quarterly updates. They want to go attend the social events, pre-pandemic world, of course. So it really depends on what kind of a leave you want to take. And also, it's okay to change your mind, right? You might have this idea that you're going to go on maternity leave and you're going to go on coffee dates every day. And then you might have a really colicky baby who cries all day long. And that is a really difficult thing to get out of the house. And I think being flexible with what can happen is really important. And also we always talk about like having a support list. I think you guys talk about this a lot too, right? Like it really takes a village to raise a child. And so your village has never been more necessary than before when you have a baby. And so navigating motherhood can be equally rewarding and daunting. But when you have the right people surrounding you and supporting you, it can just make it so much more manageable and enjoyable. We really encourage for you to create a support list of people, whether that are family members, friends, medical professionals, midwives, doulas, counselors, coworkers, new moms groups in your community, someone to hold your baby while you shower, someone to check in on you, even just a 15-minute phone call to just someone to talk to. Those are a few of the things that we really recommend thinking about and considering before you go on leave, and really making it about what you want, right? Thinking about the kind of leave that you want and communicating that, right? Sometimes the assumption is that you're taking 12 months, but not everyone wants to take 12 months. Some people want to take 18 months. Some people want to take 6 months. And so really taking the time to think about those things and not following what everyone else does, with the option of knowing that you can change your mind.
Yeah, and you bring some really, I was almost laughing halfway through that when you're talking about childcare, but you bring up some really good information because, Sarah, my colleague Sarah,
Yeah.
anybody who follows us knows her ordeals with childcare over the years. She's got 3 kids under the age of 7 now, but it has been so challenging for her. Both her and her husband work. They're both family doctors. And to cancel a clinic is huge. And so her childcare strifes have been constant over the years, and perhaps learning from other people and what they've gone through as well can be really helpful in choosing childcare options. So talking to the people around you and what's worked for them and what hasn't and what's worked, why has it worked well? Because you're right, there are a lot of different options out there. So finding something that suits you and your family, which might be different than somebody else, and that's totally fine.
Totally. And you don't I have 2 kids under 5 and we're at our 3rd daycare now. Like sometimes you just don't know until you start there. And like, it's really hard to fully get to know someone on a 20-minute tour and reading someone's website. And you can do your best to get referrals from other moms, but sometimes that's not always available. Be open to change.
Yeah, and understand what your values are and what's really important to you. And if that is, I don't know what that is, if that's long hours because you work long hours, then
Yeah.
a long hour daycare might not have some other things that other daycares do, but it
Yeah.
works better for you. Or if I never had time to take my children to activities. So having activities within the daycare was a really good
Yep.
thing. They took them to swimming and skating lessons. That was great for me because I wanted my kids to be involved in those, but I didn't have the capacity to do it at that point in my life. And so there's just thinking about what are those things that are really important to you and recognizing that nothing will have everything. And so
No.
what are your
No.
priorities versus what are you willing to give a little bit on is a really
Yeah.
important thing. The other thing that came up, which often comes up for me in the office. So I'm a family doctor. I have no benefits. I have no mat leave. I have no nothing. So I don't know the ins and outs of EI or sick benefits or anything like that because it's nothing that I have gone through myself. And so I often have to talk to patients when I'm putting them on sick leave. What is your policy? What is the government's policy on that? And
Yeah.
my understanding of it is very limited, partly because I don't have the capacity to go with the ins and outs. So I put that responsibility onto my patient to figure out, what does this mean for you? What do you need from me to help support you through this journey? And understanding your company's policies, but also the governmental policies around
Yes.
employment
Yes.
insurance and sick leave and disability and all of that stuff.
There's so many layers that you need to look into way ahead of going on leave, because there's, even from the government's like perspective, there's maternity leave, then it turns into parental leave, and then your employer might have top up programs that are different for the maternity leave and or the parental leave. And so it can get really complex, and that's why it's so important to confirm those with your employer ahead of time, because that also allows you to budget. And that's another piece that we talk about in the transition, is having a baby budget, because we all know babies they can add up, and all the things that you're buying, right? Do you have to buy everything brand new, or could you go on your local marketplace or Kid Swap on Facebook to buy used items, right? Does everything need to be new? Probably not, right? A lot
No.
of
Babies are pretty cheap. It's all the stuff that we buy
it's
for
the
them that's
stuff.
expensive, right?
Yeah, and we don't need all the stuff. Yeah, I think that's a really big piece in figuring out what the benefits are and how that will impact your leave from a financial standpoint.
Yeah, it's so true. Yeah, and I agree with you. Having that support plan and thinking about that before you have your baby is so incredibly important. And we talk about a few different types of support. So you broached on them, like your healthcare provider support, your
Mhm.
physiotherapy. So does your extended benefits continue through your mat leave? Are they going to cover your
Yeah.
pelvic physio and your counseling? Those types of things, right? That's a really important thing to know and to plan for, because if not, that's a big piece of your budgeting, but
Yeah.
also very important for your health. Your care providers are obviously a big one. Your functional support. So who's going to walk your dog when you're in labor at the
Yeah.
hospital? Who's going to take your toddler who's got so much energy to the park for you? Who's going to
Yeah.
drop meals off for you? And who are the people in your life that are supportive, and what do they enjoy doing? And try to use
Mm.
that to create those support plans. I often say, oftentimes we've got one friend who's super organized and likes making spreadsheets. So put
I
them in charge of creating your support plan for you. They can get your meal train going. They can figure out who's
Oh,
doing your laundry on what days.
yeah.
They can figure out who's walking the dogs. Like, these
Yeah.
people are incredible. And this is
Yeah.
what brings them joy. So give them some joy and ask them if they can do
Totally.
that job for you. Because it's hard
And
asking for
and
support, but people want to,
is
right?
people want to help you, and I think it's better to get the exact support that you need versus something that you totally don't need. So if someone asks how they can help, respond in an authentic way. What do you need? And you probably need a lot of things in those early days. Don't be afraid of asking for support, because it starts early, even later on in motherhood. You just cannot think that you can continue to do things and that you're the best person for it. And we talk about this too, maternal gatekeeping, the belief that mothers know best and mothers know how to best change the diapers, and only the mom knows how to make the baby fall asleep, et cetera, et cetera. And that starts really early. And that narrative can get really dangerous and create a really challenging situation in a family household. So it's really important to just be open to support, and knowing when you need it and knowing when to receive it.
Yeah. And oftentimes coming up with a list of a few things that you need help and letting the person choose what they'd like to do. So you're
Yeah.
not asking them to do something they don't want to do. You're giving them some options. So that's really helpful. And that the check-in person is incredibly helpful. So somebody who you can
Yes.
talk to, who loves you no matter what, whether that's your best friend or your sister or your mom or your auntie or your brother, whomever, having them just check in with a text or a phone call once a
Mhm.
week or once every few days, just so you know that somebody's going to check in on you, because it can be hard to ask for help. And we know like 50% of pregnant and postpartum people now have mental health disorders, whether that's
Yeah.
anxiety or depression, and there's so much overlap between the two
Yeah.
that having somebody check in with you can be incredibly helpful. And just having somebody to talk to is a huge help. So
Yeah.
set that
No, it
up for
makes
sure.
the world of difference. And when we surveyed mothers before creating Maturn, one of the most used words to describe maternity leave was isolation. And so that just says it all, right? Like we need to connect with one another and we need to support each other. And so it's really important to have that person in your life to be able to call at any time. Even if it's like a 15-minute check-in, right? Just someone who gets it and is willing to listen.
Yeah.
Hey Sarah, do you know what I've never asked you? Did you take a prenatal course when you were pregnant?
We did. Even though I'm a maternity care provider, my husband and I thought it would be an important process for us to go through together.
That's so cute. It must have been so hard for you guys to coordinate your busy schedules though.
Oh, tell me about it. I was a medical resident at the time and he was working full-time. We really struggled to find a course that would fit our needs and ended up doing a semi-private course that still was challenging to schedule and quite expensive.
Wouldn't it have been nice for you guys to have access to an online course with evidence-based content that you could do from the comfort of your own home or on your own time at your own pace?
You're telling me if I had had access to something like our Pregnancy to Parenthood prenatal masterclass, it would have been a game changer.
And that's the big reason we put this course together, to provide parents with access to a reliable, comprehensive prenatal education from the comfort of their own homes and the ability to watch it and rewatch it when and where they choose.
Plus, it's got so much great information about preparing for the fourth trimester, which I'll admit, I felt really unprepared for. We focus so much on labor and birth when we're pregnant without understanding how challenging breastfeeding in the fourth trimester can be.
I hear ya. And that's why we put together such a comprehensive module all about what to expect for the fourth trimester and for your newborn.
If any of you listeners are pregnant and thinking about a prenatal course, I may be biased, but I would 100% recommend our online course. Head on over to www.shefoundhealth.ca/masterclass to check it out.
We promise you won't be disappointed or your money back.
Can I ask you, what are the things that you see most frequently that people, like looking back on it, wish they had done? I love learning from those who have gone before us. So what are the things that you hear more frequently? Oh, I wish I had done X, Y, or Z. I wish I had trained somebody earlier. I don't know what it is, but what are the things that when somebody's planning their transition to maternity leave or have done it, what do they, oh, if I could do it again, this is what I would do.
I think what we hear the most is they wish they had more agency over it. They just think that everything will fall into place and you're just going to go on leave and come back to the same job, which is often not the case. On average, a maternity leave is around 1 year in Canada, and a lot happens in a year at an organization. And how do you want to be connected during that time? Like for myself personally, the first time I went on mat leave, I just went on mat leave and best wishes, see you later. And then the second time around, I was like, wait a sec, no, like I want to do it differently this time. And part of that is like really thinking about how connected you want to be, because so many mothers, we're seeing more and more women having children later on in life, right? The average age is now around 30 in Canada. And so you already have established your career to a certain point and you attach your identity to your career quite a bit. And so to just put that on pause and walk away is really tough. And I think a lot of mothers want more agency over how they go on leave, who the person they're replacing your job with. I think they'd like to have a bit more say over that because there's emotions involved with that. You're just suddenly you worked your whole career up until this point, and then suddenly someone just comes in and takes over. And so I think involving the mother, not everyone, but we hear this a lot. They want to be involved in those processes. And the other piece that is always a challenge is I wish I had looked into childcare before. I thought that I'd have my baby and I'd start looking around 3-4 months. And they quickly learned how they're like, you just cannot get in anywhere. And so that's why we do place such a big focus on childcare early on before you go on mat leave. So I think that's a big piece.
Yeah, I think I put my name on 4 different lists near the end of my pregnancy because my husband is stay at home. But I went back to work at 3 months and he needed some help. Like we put our child in 2 days a week daycare for socialization and just so he could get stuff done around the house because we were renovating and stuff. And it was hard. It was hard to get it.
So
And it was
hard.
like, it worked out. Luckily, it all worked out for us, but I can see it going completely the opposite way, given the fact that
Yeah.
we weren't quite as prepared. Because
Yeah.
when you're not in it, you don't realize.
No, you have no idea. And I think one of the things that, we hear also is I wish I had more self-compassion for myself during that time, because it's a time that can be filled with so many surprises. So really being open to how and when your baby arrives is really important, because I think so many people are fixated on due dates and that I have until X date. And then baby arrives early and you see this every day. And it's like, that wasn't part of the plan. And it was. So I think that self-compassion piece is really important.
Yeah, awesome. We've gone through a lot. So we chatted about creating a transition plan, and you've got a link on your website, but we can put that, we can try and put that in the show notes for people if they're interested. We also talked about looking at your company's policies and benefits, so including extended benefits when you are on leave in case you do need the pelvic physio or the counseling. We chatted a little bit about looking at childcare options early and figuring out what is best for your family. We talked about what is your communication plan with the office? Are you going to want to stay interactive, or do you want to be totally off when you're on mat leave? And either is okay, and everybody is different. And then we also chatted about like how long of a leave do you want? And maybe we're going to do another podcast, but maybe do you want to go back full time or graduated, return to work, those types of things. And then how to create a bit of a support plan to prepare for that postpartum period, because it's amazing, but it's also can be very challenging. And so having people around you who are useful is great. How can people find you guys if they're hunting you down?
Yeah, lots of ways. We're all over social media. So Maturn Canada on Instagram, we're maturn.com, Maturn on Facebook and LinkedIn. So lots of different ways to connect with us. And yeah, please do reach out if you have any interest in learning more about the program. And we support mothers regardless of how long of a leave they take. So whether you're taking 6 months, 12 months, 18 months, you're supported throughout the entire program.
That's awesome. And we'll put a link in your program in the show notes so people can get to it easily. So thank you so much,
Great,
Sonia, for coming on and joining us. This was a lot of information, but I think really good tidbits of things for people to start thinking about as they're planning for their maternity leave.
No, thank you. It was a pleasure to be here and appreciate you sharing your platform.
Thanks for listening. Make sure to check out our website at www.shefoundhealth.ca and to sign up for our community for weekly bump blasts. Make sure to check us out on Instagram or Facebook at she.found.motherhood and head on over to your favorite podcast app and leave a review and a 5-star rating. If you enjoyed this podcast, take a pic of yourself listening to it and share it on social. Make sure to tag us on it so we know to keep making them.